Thank you very much, and good morning, everyone. I feel absolutely privileged to be here among you today. And before starting, I have to pass you the best regards from our new Director General, Dr. Tedros. As you probably know very well, he has selected as one of his new priorities climate change and other health determinants. So this will be one of the key pillars and priorities for the World Health Organization, hopefully in the next 5-10 years, or hopefully less than that. Maybe we don't need to go for so many years and we will solve the problem quickly. I have as well to express our appreciation to Monsignore Marcelo Sorondo. Thank you so much for the vision, and our so admired and inspiring Professor Ramanatha, who has been working like crazy for the last, but not on a crazy way, on a very wise way, for the last months and so. So thank you very much for many of you who has accepted to be here and for the privilege of giving the floor to the World Health Organization, trying to put this important pillar and argument, hopefully, in all of this incredible historical debate. When we look at the encyclic at Laudato Si, there is amazing statements that I think we are not using enough. If we don't know who said that, we can think that it was an activist from an environmental group or something like that. It's something really, truly revolutionary in the very positive sense of the word, and I think we need to use it more, and probably moving from the Pope Francis, and making sure that the whole faith leaders and their incredible community, they could pass the same messages. Let me start then, since we are talking about health, let me start with the big picture. And this is something that I have been repeating a lot in the last months, but unfortunately I have to keep repeating it because this is something absolutely dramatic. According to an estimation and a work that WHO did a few months ago, the impact on the environment and our health is horrible, as you can see. It represents 12.6 million premature deaths occurring every year due to exposure to environmental risk factors. If you put those 12.6 million deaths in perspective, that represents only 1/4 of the world mortality. I mean, if we talk about communication, this could be the message that will alert the international community and take some action, but unfortunately, we are repeating that very often, but we are not reaching the level of alert that this will require. If you look at the 10 causes of death from the environment, people might think that those deaths are related to diarrheal diseases because the lack of access to safe water and sanitation, but in fact, look at the first disease that is caused by the environment, stroke. Stroke, and we are all talking about the epidemic of non-communicable diseases, stroke. Second one is ischemic heart disease. Look at the number 4, cancer. Look at the number 5, chronic respiratory diseases, and then it's only when we go to 6 that we go to the most, let's say, traditionally related diseases related to exposure to environmental risk factors. I think this is an argument that we need to use a lot because this is speaking as well to the rich countries and not only to the so-called developing countries, and this is where our very well-developed societies need to be worried and understand that this is affecting them as well. When we talk about environmental risk factors in WHO, we have considered those on a very conservative way, so probably our figure is an underestimation of the real impact of environmental risk factors on our health. We were looking at air pollution, which is one of the biggest one, inadequate water, sanitation, chemicals, radiation, agricultural practices, and above all of them, climate change, because it's definitely exacerbating all of those conditions. Let's put this in positive. This is not just that the environment is causing 12.6 million every day. If we put it in a different way, it means that if we take the right decisions and the right investments in all of those sectorial policies, we could reduce by 23% the global burden of diseases. And we are not talking about dreams or interventions that are not feasible. We are talking about feasible interventions and very much possible today. Okay. Oh. Well, air pollution, again, the Laudato Si is something incredible. We breathe air, so let's talk about what it represents air pollution. Air pollution is affecting nearly all of us, and an estimated, again, according to WHO estimation, 6.5 million deaths associated with air pollution in 2012. And this is, again, a big proportion of the global deaths occurring every year. And this is the reality for many girls and women around the world today. Professor Ramanathan will tell you this on a much more inspiring way. But 3 billion people are today still cooking at their homes like, in the Stone Age, because they are still using open fires or simple stoves or burning biomass and coal without any ventilation, and this is resulting on a massive 4.3 million deaths every year. When we look at the reality in many of our cities, this is the picture of, it could be any city around the world today, very polluted, and then 3 million deaths every year caused by exposure to urban air pollution. So this has been, the global air pollution has been increasing by 88%, 8% is already dramatic enough in the last years, and unfortunately the trends are telling us that is in the rise. Again, we have fantastic pieces of the Laudato Si where we talk about cities and unhealthy life and air pollution that we will try to use very much, even in WHO when we talk to our ministers of health or our constituency. Over 80% of the world's cities have air pollution levels over the WHO guidelines for safe air. And this is attracting a lot of attention to the general public because they understand. For them, understanding climate change and health is quite difficult, but when you talk about air pollution, this is something that people understand and is causing a lot of reaction and even putting pressure on the political leaders for them to do something. Obviously, in low and high-income countries, this is an issue, and traditionally, the low-income countries have been more likely to have higher pollution levels than the high-income countries, but things are now changing dramatically as well. And this is something that I will insist a lot on it. Air pollution is the invisible killer, and it represents 36% of deaths from lung cancer, 34% from stroke, and 27% from heart disease. And this is something that talks to the general population. This is something that talks to our cities, and this is something that even very high-level presidents of very important countries might be sensible to. And if we make sure that some senators will go to see presidents and put pressure, this is the slide that they need to use, and maybe that will be very much about economic development as well. Climate change threatens your health. I think I will not insist on that because I think you will have plenty of opportunities, but whether you live on a rural village, a small island, or a big city, you will be at risk. Your health will be at risk, and this is something that we need to keep explaining and change this failure on communication that Professor Viana was referring to, and I fully agree about that. The message is that everyone, everywhere is at risk of climate change. And I agree with Jeremy. This is not just about our children, grandchildren, and all of that. It's about us. The moment people understand that this is affecting me, my child, and what is happening to me right now, that might change completely the way it's perceived and the way pressure is generated for our politicians. So I don't want to be negative, and certainly I don't want to leave you with the feeling that we are going into that terrible plane that Professor Ramanathan was describing. We are on that plane every day, but there are solutions and opportunities. So let's move to those solutions and opportunities. One of them is the urban solutions. I think here we have an incredible opportunity if we work with our municipal and local leaders. I mean, if we work with mayors or our local governance, they can be little ministers of health. Each of the mayors are now moving on a very important way. I think they have an incredible role to play. We need to engage with them. They can be the most powerful network if we use them properly, because 70% of the world's population will be living in urban areas, no matter what, by 2050. So we need to make sure that the urban health, a healthy urban planning, is very much at the heart of all of our agendas. And in WHO, we are trying to move very strongly on that, on proposing clean energy for better health, waste management for better health, better housing for better health, and obviously all issues related to transport, public transport systems, and how this will be affecting the health of the people. That can be an incredible opportunity for all of us, and obviously the technological solutions need to be present as well, but there are some that are already available, and many visionary or mayors with a good initiative are putting in place. There are plenty of health co-benefits that can be obtained from these new technologies, new ideas on access to clean energy. We need to make sure that these 3 billion people without access to any source of clean energy will change. This is absolutely unacceptable, and we need to provide solutions for that. Housing, transport, waste management, land use planning, all of that will contribute to reduce injuries, to promote physical activity, and therefore to reduce non-communicable diseases. We will reduce air pollution, we will reduce climate change, and the health benefits will be enormous. And one of the good opportunities we have here is to document those health benefits, to give a strong package of interventions and reporting back on those health benefits, and that can change as well the communication package, giving good news. I mean, Al Gore was talking about the inconvenient truths. We can talk about the many convenient truths that we have in front of us, and those are the convenient truths. If you take the right decision on a public transport system, you are doing a lot for the health of the people. We can quantify those benefits for you, and you can use it. If you are a mayor and you want to gain more votes, we can provide you the health benefits that you are generating, and that might be able for you to win the elections if you are a good one. If not, we don't want to help you to gain the elections. But anyway, so cities can support cleaner solutions, and we have now an important movement of cities monitoring air pollution, still a very small number, but the trends are very positive. We want to achieve reductions over the 5 years. This looks a very, very small target, but believe me, if we can reach at least this reduction on the 5%, taking into consideration that the trends are increasing, that will be something to celebrate. Compact and diverse cities are better for health and for climate change, but my colleague Howie Franklin will tell you much more about that, and I'm sure on a very inspiring way. And obviously, urban green and blue spaces are very important for our population, and we need to move on that. But let me tell you now about the second opportunity. The first one was the urban health, the mayor's network, the local governance. The second one are the international convention and treaties. The Paris Climate Agreement, I agree with Professor Sachs. We need to say good things about it, and it's still valid. It's more valid than ever, and we need to talk about those interventions. And more importantly, at least for the health community, we need to explain to our citizens that this is not an environmental treaty. This is most importantly a public health treaty, and probably one of the most ambitious, more positive, and the one that will generate more results. So you may think that this is an environmental climate treaty. For us, this is a public health treaty if implemented, and we will make sure that this is implemented, and we will be there to tell people about the benefits of that. What can we do about climate change? Explaining to people that all of the interventions that the climate treaty are proposing are not only to protect the glaciers and the polar bears and the next generation, but to protect us and to make our life better, to have a sustainable transport, and then instead of the very sedentary lifestyle we have, we can walk, cycle, use public transit, we can have social interaction in our cities, and we can have even better mental health, among many other things. Opportunity number 3, and this is again another international major agreement, the SDGs, the Sustainable Development Goals. This is where we have the opportunity to influence all of those policies and saying this is in the name of climate change, but this is in the name of health as well. When you look at health, the SDGs 3, and I'm a medical doctor and I work at the World Health Organization, but for me, the real health is not an SDG 3, that's disease. For me, the real health is an SDG 7, which is access to clean energy. If we can influence that, if we can bring clean fuels for those who do not have access now, if we can reduce emissions of those places where we are now generating a lot of emissions, if we can influence the way our cities, our urban development is taking place, if we can influence the way we produce, we consume, we recycle, and if we can influence the number 13, wow, that will be health. And the health sector will be just receiving the benefits of that without even the investment, and the investment will be done by other sectors. So this is an incredible opportunity. Obviously, we need to empower the health people to be able to use those arguments. Sometimes our health workers are not empowered to use those arguments. They think that health is disease, and they take care of the disease, but they don't go as far as understanding the root causes of those diseases and the role that they can play. Have a look at this map on the SDG 7, which is access to clean sources of energy, and tell me if, according to this map, which is a very interactive map, and I invite you to visit that, because then you can go on your own country and see how many deaths are occurring every year due to exposure to air pollution. You have a lot of information, and this is a platform that we are convening on air quality and health. Go to that and you will see the arguments why we need to influence and convince those who are responsible for the SDG 7 that this is all about health as well. And not only, if they take the right decisions on the investment and the right sources of energy, clean energy, we can quantify for them the health benefits and produce a different map with all the good results on the health of the people that they are contributing to. And obviously, we need to do something for those who are burning their opportunities. They don't have a clean household energy, and this is fundamental for health, for sustainable development, and for women's rights and gender issues, because the women are the one cooking at home and using those very pollutant fuels, and therefore getting sick and not going to school. And again, this is what we are proposing a lot, to move on health as the pulse for this new urban agenda. And there are plenty of arguments that we can use to promote more action into that. Guidance on urban mobility. There will be fantastic on what is happening at the moment, the many initiatives, a catalog of ideas on how, if you are a mayor, what can I do to improve my urban development, to make it healthier, and therefore contributing to climate change, to air pollution, and to the health of the people. Almost there, and this is the Global Ambient Air Pollution Database that I invite you to visit. It's in the WHO website. And the responsible consumption and production. This is something that waste management, unless countries start to invest on the way, on a very strategic way, they will be dealing with waste. This is an issue that will represent a major challenge for all of us. We are tracking investments on the arguments are very strong, but we are tracking the investments on health, on the climate change community, and this is the results. I mean, only 1% of the financing coming from the climate change community is going for health. And believe me, health is very much affected, and the first front line workers are the ones receiving now cases and alerting, and somehow we need to increase the resilience of the healthcare facilities, and we need to protect those who are most vulnerable. So the financing is critical here because it's only 1%. I got the message, but I will we can as well lead by example, and this is another way to engage the health sector. We can reduce our own emissions, we can be more effective and efficient in the use of chemicals, energy, water at our healthcare facilities for those rich countries, of course. For those countries where healthcare facilities, they don't have access to any source of energy, the idea is, at the contrary, to make sure that they have access to clean energy by solar panels or other means that at least that they will be able to function. And this is very much, of course, about the future of our children, and that's why we did an estimation of the burden of diseases caused by the environment for children, and the data is, again, dramatic, and we are trying to use those messages as well to alert. This is another opportunity, partnership, and I think this is what we are trying to do here today, making sure that we join forces with all UN agencies, academia, networks of mayors or groups, activists, whoever can contribute to all of that. But most importantly, we need to mobilize the public, the general public, because those are the ones that will generate the political pressure that is very much needed. And this is the last opportunity I want to discuss with you. Every year, the total expenditure on health is going, 96% is going for treatment, for curative, and only 3.6% is going to primary prevention. And this has to change. And therefore, primary prevention is probably one of the best opportunities, so that the health community, we are ready to start to talk again about the importance of primary prevention, and tackling the causes of climate change and air pollution is for us definitely a major opportunity for primary prevention. Thank you very much for your attention.